We opened our unit officially on October 1st. It's a 17-bed, all private room unit. Our patients are required to participate in 3 hours of therapy a day, a combination of PT, OT, and speech. We staff our unit with an RN to patient ratio of 1 to 6. We do have care assistants and unit receptionists as well. Our patients eat in the dining room. They're 3 meals a day, and they participate in their therapy in our rehab gym, which is down the hall from our unit.
My name is Dr. Matt Kellum. I'm a licensed physical therapist here at East Alabama Medical Lanier. So the unit here, this is an acute inpatient rehab, so we generally see people from 7 to 21 days on average. Primarily we see neurologically involved patients. We also will work with orthopedic patients, cardiovascular patients. This is anyone that is coming from the hospital and they're not quite ready to go home yet, and we're trying to get them back to their normal, daily function. We work on things like their walking for physical therapy, lower body strengthening, conditioning, range of motion, just healing from post-surgical procedures, and also we have a little overlap with occupational therapy for like activities of daily living. Something like the standing frame is a piece of equipment where we help people stand for a longer period of time. The goal there is anywhere from a few minutes up to 10, 20 minutes and even longer. Those things allow people to stand more, it improves their balance, helps with their walking for physical therapy. And then we will co-treat with occupational therapy to, like, they'll work with their hands and their arms, lifting weights, things like that. We also have a couple of bikes in the room. That's for range of motion, strengthening, conditioning. We use that with every patient, but that is not a primary mode of treatment. We like to do more hands-on, definitely more skill treatment, education. We have some resistance bands, we have resistance weights, we have resistance bars. We all use those. Again, the primary thing with a rehab unit is that we strengthen, we help people get more mobile. So any of those pieces of equipment we can use, will help them, achieve their goals and recover faster. Also directly behind me, we have a set of parallel bars. We use that for teaching people to walk again, help with their balance. There's a lot of different things you can do with, just a set of parallel bars for rehab. It's kind of a staple of what we use. We also have a treadmill that we use for people to, practice walking on, and we're in the process of getting a body weight support system that will help offload people's body weight to get them, walking a little easier.
In relation to our unit versus a skilled nursing facility or a nursing home, the main difference is the qualification for the amount of rehab time our patients have to endure a day. It's 3 hours of PT, speech, and OT, a combination of the 3. Other units, they don't have that stringent requirement, so our rehab time is much more strict that they have to adhere to. We have a fully functional kitchen. We have washer and dryer. You'll walk through and see our patients actually cooking. It's really important. It's all about their prior level of function before their injury. So if it's the female of the house and her duty was, she was responsible for washing and drying clothes and preparing meals, then we need to make sure she can do that before she's discharged. So that's one benefit of our unit. We get fresh baked cookies and muffins a lot of times, and our patients really enjoy it. They have to maintain their prior level of function before they go home.
We try to simulate daily activities, what they would usually do at home, whether it be preparing small meals for themselves or large meals, washing dishes, using the dishwasher, standing at the sink, getting items in and out of the refrigerator. And a lot of times we have patients here that may not have used a walker or any type of assistive device prior to, and so learning how to manage a device while still doing those tasks that they'll have to do at home is a little bit more difficult for them. So we actually practice those things. Here, this is where we practice bathtub transfers or shower transfers. We can do a variety of different transfers here, whether we step over into the tub. Some people have a transfer bench that actually comes out and they sit first and then do their legs over it, which is much safer.
Our employees, as well as our patients, have a very great view of the Chattahoochee River. All of our private rooms overlook the Chattahoochee. It's just a very surreal, calming environment. It's something like you won't find anywhere else. It's wonderful. When we affiliated with East Alabama Medical Center, we took a hard look at our service lines, and those service lines that maybe were smaller and it made more sense to combine with the main campus, we did so. So we found open real estate on the second floor of our hospital. So we really, looked to see what kind of unit made sense for us. And for the community, we really found that we needed something like the rehab unit so our patients didn't have to drive so far. Yeah, we already had staff in place here that wanted to maintain working at the Lanier campus. We just found it to be a huge benefit, and it's really brought life back to our hospital. We see all of our units filling up, and that is something really important for our employees, and it feels like the old days here. So.